patient stated that she was wearing glasses before and she's not wearing them anymore, so most likely she will be getting an optometry referral. And then as far as everything else, she is, appropriately developed for her age, her height, weight, and BMI. I would win the percentile. And then she is also up to date with all the immunizations. So I'm gonna start with asking my patient a few questions. What's your name?
Never.
Natalie? That's very pretty. How old are you?
10.
Okay, what grade are you in?
4.
Fourth grade. How is school? How do you like school? You don't know? What's your favorite subject? You don't have one?
No.
Not yet. Okay. What about your diet? Do you eat fruits and veggies every day? Not so much? What's your favorite food?
Pupusas.
Pupusas. Okay. They have veggies on it. There is cabbage on it. We'll probably have to add a little bit more fruit for her and veggies. At least 5 servings. That's the recommended. How about milk and cheese? You drink milk daily?
Milk? I don't drink a little bit.
Only a little bit? Okay. So it's also recommended to get 3 servings of like low fat milk and dairy if you can. We'll talk about it after my video is finished. And then at school, do you have friends? Do you like school?
Yes.
Okay. Excellent. And then I'm gonna have you jump down, and then I'm gonna have you walk on your tippy toes like this for me. So just walk on your tippy toes for me.
Okay.
From there to here. Yeah, go for it. It's okay. Perfect. And then walk back towards her on your heels like this.
Okay.
Yeah, there you go. Perfect. Go ahead and touch your toes like this. Okay, let me just check your spine. I'm just gonna lift your shirt up a little bit, check for the curvature of the spine. Perfect. Perfect. Thank you very much. Go ahead and have a seat right here. So first of all, I'm gonna check my patient's skin, for the lesions and birthmarks and discoloration. For the purpose of this video, I'm not gonna remove her clothing. Basically from what I see, the skin looks normal. The temperature of the skin is warm, it's dry and intact. And then her hair is evenly distributed. There is no signs like of infection or infestation of her head. I'm gonna put some gloves on, and then I'm gonna palpate her scalp and proceed with the assessment. Okay. Just gonna gently touch your scalp. Okay, do you have any pain? No? Okay, perfect. And then I'm gonna move on to the examination of her head. So based on the palpation, her head is symmetrical. There is no lesions noted on her head. And then I'm gonna go ahead and check her eyes. So I'm going to shine a light in your eyes. Go ahead and look at me. Okay. Maybe not. Let's see. There we go. Look at me. Perfect. Just checking the pupil reactions. And pupils are equal, round, and reactive to light. And then I'm gonna have you follow my finger with your eyes. Move your head. Perfect. Up and down. Perfect. And then go ahead and look at the light. Focus on the light. Look at the light. Look at the light. Look at the light. discharge noted on this side. Let me check the other side really quick. Beautiful. Perfect. No infection noted in the ears. And then I'm gonna have my patient go ahead and remove your mask. And then open your mouth and say, ah. Okay. Uvula rises symmetrically upon phonation. Dentition is present, no missing teeth, no cavities. And the buccal mucosa is pink and moist, and hard and soft palate are intact. And then I'm gonna also look at your nose. Go ahead and tilt your head back a little bit. Just gonna shine light. And then the nose is also symmetrical, no discharge noted, and no deviated septum noted. And then lastly, I'm gonna check your lymph nodes. Okay, just gonna gently palpate. It might tickle a little. The cervical nodes, clavicular, and then I want to check your trachea. Perfect, thank you. Go ahead and swallow for me. Perfect. Trachea is midline. So now we're gonna move on to the thorax and abdomen and heart inspection. So from just looking at my patient, she doesn't have any respiratory distress. Her breathing is even and unlabored. I'm gonna go ahead and listen to her lungs and heart really quick. Okay, so I'm gonna place the stethoscope on your chest. So right now, just breathe normally. I'm just gonna take a listen to your heart. Perfect. And then go ahead and take a deep breath in and out. Beautiful. One more time on this side. One more time right here. In and out. Perfect. And then I want to take a listen in the back. One more time. One more time. And one more time. Perfect. And then I'm gonna check for, take a deep breath in and out for me. Perfect. So upon auscultation, the respiratory rate is even, no wheezing or adventitious sounds heard. And then the patient has symmetric expansion. For the cardiovascular, she has regular rate and rhythm. I didn't hear any murmurs, and I want to mention that I should be listening to the heart in 5 locations for a full minute, but because of the time of the video, I kind of compressed the examination of the heart. And then I'm gonna listen to her abdomen to check for bowel sounds. Just gonna listen to your tummy. One more time here. One more time here. Perfect. So bowel sounds are present in all 4 quadrants. Going back to cardiovascular, just gonna check your capillary refill here, which is under 3 seconds. And I'm gonna also access her pulse right here. Yes, pulse is nice and strong. And then I'm gonna check your reflexes here, so just relax. Perfect. One more time. Okay, perfect. push me down, push me down, hard. Perfect, okay. And go ahead and squeeze my hands, squeeze, hard. It's okay. Perfect, good job. And then go ahead and press on my hand like you're pushing gas pedal. Perfect, and then this one. Perfect. Okay, and then I'm gonna have you lie down for a second. I'm just gonna palpate your stomach. Go ahead and lay down for me. Oh, lay down. Can you translate?
¿Se puede acostar?
Okay. Perfect. Okay. You can go ahead and bend your knees like this. Go ahead to bend her knees.
¿Sí puede levantar las rodillas? Ajá.
And that's what
Sí, es el...
Así, así. Levantando.
Bend the knees.
Pero doblarlos.
That's okay.
Doblar.
Never mind that. Okay, I'm just gonna palpate. And let me know if you have any pain. Dolor?
No.
No? Aquí, dolor?
No.
Aquí, dolor?
A little bit.
A little bit here?
Mhm.
Okay. How about here?
A little bit.
A little bit, so this side hurts. A little bit. Okay, but I don't, upon palpation, I don't feel any masses or organomegaly. Okay, you can go ahead and have a seat. And I think that's it. That will conclude the physical exam. I'm gonna go ahead and talk with the mom about anticipatory guidance, which is basically 3 servings of fruit and 5 servings of fruit and veggies a day, 3 servings of dairy a day, low fat, and then there's your doctor. Okay.